Ever wondered what happens when an ACL tears? Let's first explore what the ACL is and why it's so important. Nestled within the intricate structure of the knee, the anterior cruciate ligament, or ACL as it's commonly known, is one of four major ligaments that connect the thigh bone to the shin bone. Imagine the ACL as the knee's own personal bodyguard. Its main job? To provide stability, particularly when the knee twists or turns. Picture a basketball player weaving through opponents or a footballer making a quick pivot. It's the ACL that allows these dynamic movements, keeping the knee stable and preventing it from buckling under the pressure. Now consider the immense strain these actions place on the ACL. It's no surprise that injuries to this ligament are quite common, particularly in sports that require sudden stops or changes in direction. So, the ACL plays a crucial role in the knee's functionality. But what happens when it tears? Imagine running at full speed and suddenly changing direction. Feel that twist in your knee? That's where the trouble begins. An ACL, or anterior cruciate ligament tear, is a common injury among athletes and non-athletes alike. The culprits? Often it's sudden changes in direction, like when you're playing football and you pivot on one foot to dodge an opponent. Or maybe you're a basketball player who lands from a jump incorrectly. Even a direct collision, such as a rugby tackle, can cause an ACL tear. Picture this. Your knee joint is a complex structure of bones, cartilage, and ligaments. The ACL is one of these crucial ligaments, connecting your thigh bone to your shin bone, providing stability and control. When you make a sudden movement or take a hard hit, the strain can be too much for the ACL, causing it to tear. It's a sudden, often painful experience that can stop you in your tracks. A torn ACL can be a serious setback. But exactly what happens when it tears? The moment the ACL tears, the knee loses its stability. Imagine it as a ship unmoored in a storm, suddenly vulnerable to the onslaught of waves. The first wave that hits is the pain, sharp and immediate, like a lightning bolt to the knee. It's a signal from your body, a distress call indicating that something is seriously wrong. Quick on the pain's heels, the swelling begins. Your body, in its own way, is trying to protect the injured area, but this swelling can lead to further discomfort and difficulty in movement. This is why you might find yourself limping, struggling to put weight on the affected leg. But what's dangerous is not just the pain or the swelling, it's the instability. The ACL, or anterior cruciate ligament, is like the anchor of the ship, keeping the knee joint stable amidst the sea of movements our legs make every day. When it tears, the knee becomes unstable, like that ship in the storm, vulnerable to further damage. It's this instability that can lead to injuries to other structures within the knee if left untreated. In the immediate aftermath of an ACL tear, the body's response is swift and multifaceted, ranging from pain and swelling to difficulty in walking. But this is just the beginning. The real challenge lies in what comes next. So we've understood the immediate aftermath, but what about the long term? Healing a torn ACL isn't as simple as sticking a band-aid on it. It's a journey, one that may span several months, sometimes even over a year. The first step in this journey happens to be the decision-making process, where you and your doctor decide whether surgery is the right path for you. Not everyone requires surgery for an ACL tear. Sometimes physical therapy and a change in lifestyle might just do the trick. But let's say surgery is indeed needed. Post-surgery, the road to recovery is paved with rest, rehabilitation exercises, and a whole lot of patience. The importance of rest cannot be understated. Your body needs time to heal, to knit together the torn tissues. Then comes the rehabilitation phase. This is where you rebuild strength and regain mobility. It involves a series of exercises tailored to your specific needs, designed to gradually increase the functionality of your knee. It's crucial not to rush this process. Patience, remember? And here's something to keep in mind. A proper recovery process is vital to prevent future injuries. It's not just about getting back on your feet, it's about making sure those feet and knees can carry you forward without stumbling, without faltering. And that, folks, is what happens when an ACL tears. Remember, prevention is better than cure, so take care of those knees.